Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so excited to introduce you to our guest today. Her name is Abby Brown, and she is a licensed practicing counselor, and she is an expert in eating disorders. And so she's going to talk to us today about what an eating disorder is, how to be on the lookout, and what we can do about it. With that, let's get to Abby.
Thanks for having me. I'm super excited.
Yeah. Okay. So we're going to be talking about eating disorders. So can you tell us a little bit about your experience and the population that you work with?
Yes, so I got my master's in clinical mental health counseling, graduated in 2021. So I've been working in the field ever since then. So I have about 3+ years of experience at this point. And honestly, since the beginning of my career, I always knew I wanted to specialize in eating disorders. Um, the reason being is more often than not, it's young girls, or, women, and I have a passion for working with, um, teenagers, women. That's not to say I haven't had male clients because I absolutely have, as well, but it's just where I find my passion. It's something that I think is there's always help needed for that. Yeah, of course, I see other people for other things, but for the most part, most of my caseload is eating disorders.
Yeah, awesome. Well, we're so glad you're out there helping people. So can you tell us about what does an eating disorder or disordered eating look like or mean when we say
Yeah.
those words?
So an eating disorder is a mental disorder that affects how you think about food, your weight, your body shape, which oftentimes in turn affects your eating habits. And then even going further from that point, in more serious cases, it affects your physical health. So I think that's something that most people don't know is that an eating disorder is a mental disorder. Like I said, it affects how you interpret food and your body and weight.
Yeah. Is disordered eating different than an eating disorder?
Yes and no. For an actual eating disorder where you're meeting the criteria that we use the DSM-5 to diagnose, of course, you have to check certain boxes for that diagnosis. So in my mind, disordered eating can still include things that an eating disorder is. Maybe you're just not checking all of the boxes to meet full criteria for an eating disorder, but maybe you still struggle with some of those things.
Yeah. So what is when we also hear a lot of words around eating disorders or when we look at the DSM, the actual diagnosis. So we have anorexia and bulimia and binge eating disorder. Can you tell us about those? What do they each mean?
Mhm. Yeah, so anorexia, I mean, those are gonna be the 3 main ones that you do hear people talk about. Anorexia, the main component of that is restricting food intake, which usually leads to a significantly low body weight, but not always. Um, and a low body weight too is gonna depend on the individual because we look at things like their growth charts, genetics to determine what would actually be a healthy weight for them. Most people have moved away from a quote unquote healthy weight to be determined by age and height. We like to look at their growth chart to see what is going to like make sense for them and what would be normal for them. And the goal would always be to be at a weight where your body can function how it's supposed to. And other components of anorexia is that there's an intense fear of weight gain. Weight loss is directly correlated to eating habits and not other things, not other underlying medical conditions or something outside of diet. It is purely based on the restrictive food intake. And one of the other key components is that the individual is persistently not recognizing the seriousness of the low body weight, which I think is something that I've run into with a lot of my clients is like it's not clicking for whatever reason that hey, my body weight is not where it's supposed to be, and I'm damaging my body right now. So those are the main components of anorexia. Now, when it comes to binge eating and bulimia, I'll talk about binge eating first because that'll make it easier for me to talk about what constitutes someone with bulimia. So the main components of binge eating disorder is that an individual is eating in a discrete period of time, for example, like a 2-hour time frame, more food than the average person would in the same amount of time. So the other key part to binge eating is that there's a sense of lack of control during that binging period. That's not to say there's a sense of lack of control during every time that they eat, but during this period of time. Other things that I will ask about or look for to diagnose binge eating disorder is that the individual is eating until they're uncomfortably full, oftentimes eating when they're not physically hungry, eating a lot faster than they normally would. Usually there's feelings of intense guilt, shame, or disgust with themselves after the binge eating episode. And oftentimes the person is eating alone during the binge eating due to feelings of embarrassment with how much food they're intaking. And the last two things is that the individual feels like significant distress because of the binge eating, meaning that it's something that they want to change, right? Or it's something that they don't want to be doing, just have a really, really difficult time trying to change that behavior. And lastly, the binges are happening at the very least one time per week for 3 consecutive months. And there's layers to that as well. If it's happening, kind of goes from like mild to, really intense with how often those binge episodes are happening throughout the week. But again, the main part of that criteria is that it's happening for at least 3 months. It's not something that's just like a one-off thing that I do every now and then. It happens often.
Mm-hmm.
And then lastly, with bulimia, same criteria as binge eating disorder. So checks all those same boxes, but the key difference is that with bulimia, there's a compensatory behavior happening after the binges to try and prevent weight gain, meaning the individual is doing something to almost quote unquote like make up for the binges. And there's lots of different compensatory behaviors, but the most common is going to be self-induced vomiting, misuse of laxatives, fasting, meaning like maybe they engage in a binge Tuesday night, they're not going to eat anything, on Wednesday, or they won't eat until the next evening or maybe even until Thursday. And lastly, overexercise. So those are going to be the main components for those 3 diagnoses.
Yeah. You mentioned something earlier about it being something where you can actually harm yourself by engaging in these eating disorders. Is that true?
Yeah, absolutely. So I think especially when it comes to compensatory behavior, more specifically the self-induced vomiting, that can cause a lot of long-term damage to your throat or to your teeth. And I always like to do a lot of education around that when I meet with clients who are engaging in self-induced vomiting, that although it doesn't, we're not seeing the damages right now, but if this is something that continues for months or even years, there can be a lot of long-term damage to your body. So definitely something we want to look out for. I mean, and even same thing with misuse of laxatives, right? That can affect the way your body functions. It can affect the way your body digests food. So that's why getting treatment for eating disorders as early on as possible is so, so important.
Yeah. Yeah. I'm glad that you brought that up because I think a lot of times people will be like, oh, it's not bad yet. Right. Or it's not bad right now.
Mhm.
And I think when we have thoughts around that, we are afraid to gain weight, right? And we're choosing to do behaviors to avoid that. Or that we're eating in excess, right? And we're meeting those criteria. Yes, like, I was thinking when you were saying that, I was like, Thanksgiving is definitely like a binge eating
Yeah,
time, right?
totally.
Like
Absolutely.
we definitely can, as a population, do that, but that doesn't qualify you for that diagnosis.
Right. And I think that's where a lot of people will get confused or consider themselves binge eaters. And so again, I like to do a lot of education around what actually constitutes a binge. I mean, a binge is not just overeating,
Mhm.
for at dinner. every now and then. That doesn't mean you have binge eating disorder, because as a society, a lot of us do overeat, especially when it comes to holidays, right? When we're having things that we wouldn't normally have. And it's also not a bad thing to engage in that, to maybe have a little bit more than you normally would, because it's one time out of the year or a few times out of the year.
Sure.
And something else I just thought of too, as we were talking about how eating disorders can affect your physical health too. We talked a little bit about, binging and the compensatory behaviors. But when it comes to restricting, especially if it's starting early on, which I see a lot of it being in the younger people, when our bodies are still developing, not giving our body the nutrients that it needs can cause for a lot of long-term damage. I mean, in women, it can cause issues in fertility later on in life. I've seen it cause, hair loss. When our bones are still developing and we're not giving our body what it needs, it can cause like fragility in our bones and in our bodies later in life. So like I said, it's super important to try and get the treatment or catch these things as early on as possible. So that way we can try to maybe make up for some of the damage that has already been done, and hopefully help the individual to develop normally and to help their body function at the optimum level.
Yeah. Getting back to health. Yeah.
Mhm.
That's so
Yep.
important.
Yeah,
So,
absolutely.
so how does disordered eating or disordered thought around eating happen?
Yeah, I wish there was a straightforward answer to this, because it could be lots of different things. But what I feel like I see the most of with my clients is environment. And there's so many things that can fall under the environment umbrella per se. Um, but I like to look at like the types of messages that we're receiving from social media, friends, family, or I mean, really anyone that we surround ourselves with. And I also think it's important to consider factors that would impact how food is talked about within the household.
Mhm.
For example, socioeconomic status is a big one, as that one can greatly impact access to food and the types of food people have access to. So, for example, if there's an individual that was raised in a situation where they didn't always know where their next meal was going to come from, they may be more susceptible to binge eating disorder because of this idea of, this may be my last meal for a while. Even if that's not the case anymore, those beliefs have still been developed around food. And if those are the beliefs that were made throughout their childhood or throughout their youth, those are really hard. Those are really hard to break. And on the other side of things, where I think restrictive eating could maybe be developed, is where I think social media comes into play. This idea of, wanting to be liked by others, which is not inherently wrong in itself. We all want to be liked by other people, but this idea that to be liked, I have to be pretty or attractive looking. And then connected to that is this idea that to be attractive looking, I need to be in a smaller body. And I also think too, and I've seen this a lot too in my teenagers and my adults as well, but I see it more with my teens, is if there's a lot of things in that individual's life that are out of their control, which is the case for most people. I think majority of our day-to-day life is not within our control, or we don't necessarily have a say in. Their food choices is where they can exercise that autonomy that they don't get to do in their day-to-day life. So it can satisfy this desire for control or just having a say in something. So it can start pretty, like, quote unquote small or simple, where it's like, oh, I'm gonna cut out this one food group, or I'm gonna do this specific diet. And again, like I said, it satisfies this need for, oh, but I get a say in this and no one else does, or this is something that I have complete control over. And I think it becomes a slippery slope. Um, so I mean, in summary, the factors that feed into how disordered eating patterns or thoughts are developed can be from a number of things.
Yeah. I mean, I think it's important to say that, yeah, there's not just one way that people lead themselves down a path of having disordered eating. But I think trauma can be something, right? You talked about scarcity,
Yep.
and that can be something, right? Or having somebody say something. It could be something small, which I
Yeah.
think, can be hard. So you notice that people compliment you more when you're looking thinner. And so then you make choices to change how you're eating, what you're eating, how you're
Yeah.
exercising, et cetera, around that in order to get that positive feedback from society and people.
Yeah. And that's a really good point too, where I think a lot of restrictive eating habits can get developed is, like I said, maybe you make this decision of like, oh, I'm gonna cut out this one food group, and you're out with friends and everyone orders one thing, but you order something on the more like quote unquote healthier, nutritious side, you're immediately getting feedback from, your friends or family saying like, oh, you're so good. I wish I had that type of self-control.
Mhm.
And we live in a society where self-control is deemed as good, right? Like the more self-control you have, the better you are, right? So
Mhm.
it feeds into, again, like I said, to this like desire to be liked, or this you're getting like what seems to be positive feedback from other people, and that feels good
Mhm.
for anyone. And that's not a bad thing to like getting complimented. But that it's a small way where those types of behaviors get reinforced. And depending on what type of situation that person is in, they might want more of that. So they want to
Mhm.
take it further and start to restrict more foods,
Mhm.
or, make certain choices that they think they'll maybe get praised for.
Yeah.
Yeah, I think that's a really good point too.
Yeah. Well, and something you were just saying, when we're working with kids, intermittent reinforcement is one of the most strong ways to get somebody to reproduce a behavior. And intermittent reinforcement means not all the time reinforcing that thing. So I think I was just thinking as you were saying that, like, if we get reinforced sometimes for the way our body's looking, but not other times, it's going to motivate us to try to change something else potentially to get that feedback. And that can be so dangerous. And so it's like, I hadn't thought of it being a negative thing before, but thinking about that intermittent reinforcement being there, then they like might want that more, which we all want to know that the people around us find us attractive and,
Right.
flattering, and that we look nice, and that's so normal. But then it's kind of like they're wanting to be in control, but we can't control other people. And so then the thing that they might go to is to change more about themselves in order to get that feedback.
Yeah, yeah, absolutely. Where it's like, okay, yeah, sometimes I get these compliments, but sometimes I don't. What could I do to make these compliments more consistent?
Yeah.
Yeah, I agree. I think that's where a lot of it can stem. So I always encourage people to give, if you want to give compliments, compliment things about someone's personality, right? Or
Mhm.
compliment something about someone's energy, right? Rather than their physical. Now, that doesn't mean you can't tell someone that they look nice or that they look pretty
Mhm.
or they look handsome, but I always like to err on the side of like, "Oh, you look so happy today," or, "I love it when you smile," or, I love being around you. You have such, like, you have such a warm energy about you." Those types of things I think are a lot more meaningful
Mhm.
than, "Oh, you look so skinny. What are you doing these days? Like, how did
Mhm.
you get like that?" Um, I
Yeah.
I always encourage people to do that.
Yeah. Well, and you said earlier something that I wanted to revisit too, is that being able to control things, right? Or restrict is like something very flattering. But I think the opposite in our society is that if you don't manage something, so like if you were overeating, that is very negatively
Yeah,
looked at, right? So the both of those are something that our society either values or
mhm,
doesn't value. And I think, when we look at these diagnoses, they are really a mental health diagnosis. And I think that's an important part to remember, is that there is a skewed perspective. They're not able to view things that somebody without a eating disorder or somebody on the outside can see what's happening, which oftentimes is also why there's a lot of secrecy around it, because I think there is some knowledge that what they're doing, right, would not, people are going to say something, and maybe people have, which is why they get more secretive. Is that right?
Yeah. I think I always will tell my clients this too. That, I mean, eating disorders thrive in secrecy,
Mm-hmm.
right? So something I really work on with my clients is to talk about any shame they're feeling, because the more we talk about this thing, the less power it has over you. Like every time we talk about it or say it out loud, we're slowly chipping away at the shame or disgust that comes with that. And you did bring up a good point too, where yes, we're a society that values self-control. So, ordering a salad when everyone else ordered burgers and fries, and I'll just use that as an example, because it's pretty straightforward. It's, oh my gosh, like you have so much self-control. Whereas, if we see someone who is quote unquote overeating, we immediately deem that as like, oh, this person has no self-control.
Mm-hmm.
That's bad, or that's a negative. When that's not always the case,
Yeah.
right? Like you said, these are mental health disorders that completely skew how we think about food.
Mm-hmm.
Um, so I mean, taking that into account it's more than just having self-control or not. So much
Mm-hmm.
deeper than that.
Yeah. Yeah. Okay, so this is a great segue into how can we do supportive things to build a healthy relationship around food for our kids? So, I mean, talking about just in general, we want our kids to have healthy relationship with food because it's fuel, right? Like it's energy, it helps us to go. So, what can we do to help our kids develop a healthy relationship with that?
Yeah, I always encourage parents to be aware of how they talk about food with their kids. What does the conversations around food sound like? I mean, just being aware of how we label certain foods, like most people are going to label foods as quote unquote good or quote unquote bad. I always like to encourage people to try and move away from that, because food is not inherently good or inherently bad. I mean, we need it to live. Food just is. Of course, there's foods that are going to have more nutrition versus others, but it's not something that can fall under a category as good or bad. I also encourage parents to be aware of how they talk about their own bodies and the bodies of people around them. So like, if you're a parent and you're getting dressed or looking at yourself in the mirror, and your kids are around, what types of comments are you making about yourself? Would you want your kids to talk about themselves the way you talk about yourself? Right. And I think that can help foster an environment where there's just not as much emphasis placed on bodies and, worth being connected to the type of body that we're in. Of course, the goal is health and balance. And I also think it's important to think about what constitutes a quote unquote healthy relationship with food.
Mm-hmm.
Um, that's going to be very different for everyone, but I do think there are a couple things that are pretty objective. I think balance is really important. We don't want to deprive ourselves of anything, but we also don't necessarily want to overindulge on a consistent basis, especially with those foods that aren't going to be as um, nutritious. I'll use like candy for example, right? I'm a big candy lover. I Sour gummy candies are my thing. I don't want to
Mm-hmm.
live in a world where I can't have those, right? I want to be able to have those, but moderation and balance is key. Am I also getting in vegetables, protein, carbs, fats? And like, am I also getting those things into my day-to-day diet?
Mm-hmm.
Okay, if that's the case, yeah, having some candy or treats that maybe aren't going to be as nutritionally dense is okay. So I think balance and moderation is one of the main keys to a healthy diet, and also just giving our body what it needs, right? Like especially for people who do sports and are athletes, or like on their feet all day long. We need to make sure our bodies can support what we want to do.
Mm-hmm.
So, whatever a diet that can support that looks like, is something to consider when we think about a healthy relationship with food.
Yeah. So talk to me about this. So let's say our kids are wanting to pick a treat. This happens at my house where we
Mhm,
have I have shelves with like foods that my kids can generally have, right? But there's some of them that are more like treat based, and then some of them that have more like protein is a big thing in our house that we talk about is like fueling our bodies with protein.
mhm,
Um, how can we talk to our kids about like not picking the more like junk food kind of things, or like we know that maybe a beef stick would be a better option, or carrots and hummus, or hard boiled
mhm.
egg, I don't know, things like
Sure,
that. And so
sure.
it's like we're picking those because they help our kids to feel good, right?
Mhm,
That's something else that we talk about at our house is like what does your body need? Like, are you needing energy, right? Are you just wanting a treat? Kind of that kind of stuff. Like, talk me through how a parent could have these conversations in a real format with their kids.
Yeah, that's a great question. And I think it's important to look at, yeah, what does real life look like day to day? And I think, like I said, balance is going to be key, right? If you have a kid that likes to lean towards the treats, like more of the candy or things that again aren't going to be as nutritious, what else have they eaten that day? And okay, if you want to have, some candy, let's have a beef stick, let's have a hard-boiled egg, something that is more nutritionally dense. And then we can also have this. So
Mhm.
that way you're getting both without creating an environment where it's okay, we can never have these things, or you
Mhm.
or you can't have that. It's we can have both. And I like what you said too about what feels good to your body. I have lots of nieces and nephews, and I can think of a time where, one of my nieces, ate a lot of candy or had a big piece of cake at a birthday party, and later she's saying, "Oh, my tummy hurts," and kind of being and helping them make that connection of yes, those things we are totally allowed to have. We can have the cake or we can have the candy, but we also want to recognize like how that does impact our body and start to help them be able to make that connection on their own. So that way when they are making choices, they might make the connection like, okay, if I haven't had any protein or carbs today, it's probably not going to feel the best on my stomach to have just candy. So
Mhm.
creating a space where they get to have the choices, um, but again, also doing some like education with them around why it's important to give our bodies fuel, especially for kids, right? It's like you want to be able to go run around and play on the playground and do these sports.
Mhm.
Okay, well we have to put the proper things in our body to be able to do that, and consistently having things that aren't as nutritious is going to get in the way of doing that. So
Mhm.
kind of highlighting the connection between the two to help your kids understand why it's important to fuel our bodies, but we can have both.
Yeah, I love that. I think about the times where my kids are like having a meltdown, and it's
Mhm.
because we probably either have gone too long without eating or we need some protein. And then after they've done that, sometimes reluctantly to eat some protein, I'll be like, your body needs protein. It's begging for it. Like,
Right.
can we, here are options. Does anything sound good? Could you take one bite? Right. And then
Yeah.
oftentimes they want to take more after that. But I'll talk to them later and be like, "How do you feel now? Like, it looks like you're back to your, like, normal, healthy self," right? And they'll even say, "Yes, I feel so much better." And I'm like, "That's such a cool thing about what, that food can do, right? To
Right.
give you energy, and it helps you to feel better." Like, mommy feels that way too. When I notice I get hangry, and when I
Yeah.
eat
Yeah.
something, right, that has protein in it, I feel so much better. Even if it's just one bite, like, it's amazing because my body is like yelling for fuel,
Mhm.
right?
Yeah. And I think that's a cool part too that I like to encourage parents to do is again helping your kid make that mind body connection. Our bodies are hardwired to tell us like when we're hungry, when we're full. We want to listen to that and honor that. And sometimes our body's going to signal to us that we have cravings too
Mhm,
for some candy, for some ice cream, whatever it might be. And we want to honor those cravings because usually when we deprive ourselves of something, the longer we go without, our brains are hardwired to want it more, right? I'm sure
mhm.
everyone can think of a time where that has happened, where it's like, okay, I'm going to cut XYZ out of my diet. The more days we string together without that thing, the more we want it or the more we
Mhm.
think about it. So allowing yourself to have to honor those cravings is just as important as giving your body the fuel it needs. And I always joke too with a lot of my clients too about that saying from the Snickers commercials where it's like, you're not you when you're hungry. I think there's a lot of truth to that. I mean, especially
Mhm.
with kids is, if they're having a hard day or throwing a temper tantrum or whatever it is, almost the first question needs to be, okay, what have you eaten today? And like, have you drink water? Um,
Yes, yes, sure.
and okay, if those two needs have not been met that day, that's probably going to be the first line of defense before even more hunger, which is a very real thing. So yeah, I think there's a lot of facts to back up the you're not you when you're hungry.
Yeah.
There's a
Yes.
lot of truth to that.
Exactly. Okay. So something you said earlier that I liked too, that I think parents can do to help build a healthy relationship around food is also like sitting together to eat.
Mhm.
Because you said meals in like private or eating in private can increase that. So something we could
Yeah.
do also is I know that it's not possible maybe for every family all the time, but the more
Yeah.
that we're sitting down to eat a meal, right? And our kids
Yeah.
are seeing us and our teens are seeing us eat, right? And
Yeah.
we're kind of getting a pulse on that too, probably creates for some healthy thought around food.
Yeah, absolutely. Because there's, I always like to encourage family dinners or just being in situations where you are eating with other people because that normalizes eating,
Mhm.
right? Which I know sounds kind of silly to say, but for and like you said, it may not always be possible for every family, but as much as possible, having meals together. What us as adults are modeling to kids is huge. Probably it carries way more weight than what we tell them, is
Mhm.
what we show them. What are they seeing us doing? And you know, food is a huge part of our society. Our kids at some point in their life are going to be in situations where they have to eat with other people, right? Like at school for lunches. If they're part of a sports team, when they go out to dinners or go out to breakfast or go on dates later in their life, normalizing eating in front of people and trying to reduce any shame or embarrassment around
Mhm.
eating is going to be ultimately helpful for them in the long run and their ability to make social connections and do things with other people. So and that starts at home. Like I said, I mean, environment has I mean everything to do with fostering a healthy relationship with food. So like yeah, so as much as you can having family meals or making sure your kids are seeing you eat as well.
Mhm. Yeah, absolutely. I think that's great advice. So, on the other side of that, what should parents be on the lookout for in terms of identifying disordered eating?
Mhm. Yeah, I think a couple things. I encourage parents to be aware of any drastic shifts in diet. So, and this might be more common with teenagers or as the kids get older, maybe not so much in the super young ones, but like for example, if your kid has always liked pizza, right? And pizza is like one of their favorite things to have, and all of a sudden they're not eating pizza anymore, out of the blue, I mean, that could potentially be a sign for some type of disordered eating. Um, and it may not be pizza, but really anything, right? If you consistently make burgers or something for dinner and they usually have one, then all of a sudden one day they are saying they don't want it anymore, they don't like it anymore, that would be something to look out for. And that being, it's going to be different for each child, right? Like that's not to say people's taste for things doesn't
Mhm.
change, but if they have consistently liked certain food items and then all of a sudden stop eating them or refuse to eat them, definitely something to look out for. If they spend an abnormal amount of time in the bathroom or are adamant about being alone after meals, that might be something to look out for as well. If your child starts to talk about wanting to lose weight, looking a certain way, or wanting to fit into a certain size of clothing, I think can also be kind of like yellow flags, that may raise some questions. Other things to look out for might be if your child is like cutting up their food in really tiny pieces, eating abnormally slow, eating abnormally fast, only wanting to eat when they are alone, or even like hiding or storing food in their room. And also, I want to specify too that these things I just mentioned, that these isolated behaviors are not necessarily abnormal, especially when raising teenagers. They might want to be alone or talk to their friends or do homework after meals. That's not a bad thing. That is probably going to happen. But if these are happening on a consistent basis, um, for a long period of time, like maybe for like a month or a few weeks in a row, they are, spending a lot of time in the bathroom after meals or getting up to go to the bathroom for a long period of time during, family dinner, that might again raise some questions.
So, how could we bring that up? Is that something we would
Mhm.
say like, "Hey, I've noticed this." Do we get curious? Like, what's the best strategy?
Yeah, I'm glad that you mentioned the word curious because that was what I like to tell my parents is I always encourage people to have like an open, honest conversation and coming at it from a place of curiosity instead of assumption. And this will give your child the opportunity talk to you about what's going on without them feeling like they're in trouble or that they've done something wrong. So this could look like parents talking to their kids about what they've noticed. Like, for example, if you notice a drastic change in their eating habits, telling them that, like, hey, I noticed you haven't touched your pizza the last few times we've had it. And I know pizza's one of your favorite things to eat. Is there anything going on that you want to talk about? And coming at it from a parent as a place of support and like, hey, part of my job as a parent is to make sure you're healthy and make sure your body is getting what it needs. And I want to make sure that's happening. So again, kind of using this idea of like observe and describe, like instead of assuming, hey, I've noticed you're not eating your pizza, something must be wrong, is, hey, this is what I've noticed, describing that to them, what you're seeing, and just kind of opening up the door for them to talk about anything that's going on, right? Because it might be nothing, or it could be something, but giving them the opportunity to open up about it in their own way, again, rather than making assumptions or already deciding there's a problem when there might not be one, I think is going to be the best way to do that. And I just think that fosters a healthy communication between a parent and a kid.
Yeah, I mean, because also they don't need more shame, because a lot of times this
There
diagnosis
already
is bringing,
probably.
yes, right?
Yeah.
There's already some feelings about what they're doing, probably, whether it's ahead of time, like they want their body to be smaller, right? So they're already having a feeling, or the behavior that they're doing is making them feel a certain way, as
Right.
coming at it from a place of like, hey, I'm concerned about you. I just want to know more about this, right? And it doesn't have to be just a one-time conversation, because maybe your teen or whatever would say, oh no, everything's fine. Or maybe they say, maybe it's really that they've decided they want to be vegetarian or
Right.
whatever, right? And
Right.
so then it's like, okay, so then you order the pizza with just cheese. And so then you see, does that change their behavior? And to say like, hey, you said this and we did this, but I'm curious, it didn't seem to change anything around that. Can you help me to understand?
Right. And I'm glad you brought that up too, because that's also possible, right? Like they might want to make changes in their diet for other reasons. Like, okay, your kid wants to explore being vegetarian. If that's something you want to support, okay, great. Like what are other alternatives? Make sure you're still getting your protein, right? Still
Yeah.
making it very health focused, and being flexible and working with them. Because like you said, there's probably already some change or some shame stirring around in them, and going into the conversation with assumptions is going to make them feel like they are doing something wrong, and it's not, right? Like there's probably just some things going on that they're having a hard time verbalizing or having a hard time coping with. So opening the door from a supportive, loving, caring place is going to go a lot farther, than kind of charging into the conversation with things already decided for them.
Absolutely. Well, thank you so much, Abby. This has been such a great conversation. I so appreciate it.
Yeah, absolutely. Thanks for having me.
Thanks again, Abby. That was all fantastic information. I hope you enjoyed our show today. If you like our show, if you like what we're doing, please rate and subscribe to us. Follow us on Facebook, Instagram, YouTube, and TikTok, and also keep the emails coming with future topic suggestions for our show to accidentalexperts@gmail.com. Have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.